It's good to see you and welcome to another video. In this video, we will explore the world of knee sprains, examining their causes, symptoms, diagnosis, treatment, and prevention strategies. Knee sprains are a common injury that can cause pain, discomfort, and limitations in mobility. These injuries, characterized by damage to the ligaments in the knee joint, can occur during sports, accidents, or everyday activities. According to statistics, knee sprains account for approximately 40% of all sports-related injuries, making them one of the most common orthopedic injuries worldwide. Moreover, studies indicate that up to 250,000 anterior cruciate ligament injuries occur annually in the United States alone. So let's get started. The femur and tibia form the main bones of the knee joint, while the patella, also known as the kneecap, lies in front to protect the joint. Ligaments are strong bands of tissue that connect bones together, and in the knee, there are four major ligaments: the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. These knee ligaments provide stability and prevent excessive movement of the joint. Tendons connect muscles to bones, and in the knee, the quadriceps tendon connects the thigh muscles to the patella, while the patellar tendon connects the patella to the tibia. These tendons allow for movement and provide strength to the knee joint. Articular cartilage, which is a smooth and slippery tissue, covers the ends of the bones within the knee joint. This cartilage allows for smooth gliding of the joint surfaces during movement, reducing friction and facilitating pain-free motion. The menisci, which are C-shaped pieces of cartilage, act as shock absorbers and help distribute the body's weight across the joint. They also enhance joint stability and provide cushioning. So let's now look at how a knee can become sprained. A sprained knee occurs when one or more ligaments in the knee joint are stretched or torn, which are those tough bands of tissue that connect bones together and provide stability to the joint. When a sprain occurs, it affects the ligaments responsible for holding the knee joint in place. The knee ligaments involved in sprains are the anterior cruciate ligament, which sits at the front of the knee, the posterior cruciate ligament, which sits at the back of the knee, the medial collateral ligament, which sits on the inner side of the knee, and the lateral collateral ligament, which sits on the outside of the knee. These ligaments can be injured during sudden movements, twisting, motions, or direct impact to the knee. When a knee is sprained, the ligaments may become overstretched, partially torn, or completely ruptured, depending on the severity of the injury. This can result in pain, swelling, instability, and difficulty bearing weight on the affected leg. In addition to the ligaments, other structures within the knee, such as the menisci and the joint capsule, may also be affected during a sprain. Damage to these structures can further contribute to knee pain, limited range of motion, and knee instability. So let's now take a look at how a knee sprain occurs. A sprained knee is typically caused by sudden or excessive forces that put stress on the ligaments, leading to their injury. Common causes include sudden twists or pivots. These are abrupt movements that cause the knee to twist or rotate beyond its normal range of motion and can strain or tear the ligaments. This can occur during activities like changing direction rapidly or landing awkwardly from a jump. Direct impact. This is a forceful blow to the knee, such as a direct blow from a car accident or fall, can damage the ligaments. The impact can stretch or tear the ligaments depending on the intensity of the force. Hyperextension. This is when the knee joint is forcefully bent backward. It can strain or tear the ligaments. This can happen during activities like landing with a locked knee or when the knee is pushed beyond its normal limits. These causes can damage the ligaments by exerting excessive force or stretching them beyond their capacity. Ligaments are designed to provide stability to the joint, but they have limits to their elasticity. When these limits are exceeded, the ligaments can become overstretched or torn. The stretching or tearing of ligaments disrupts their structural integrity and affects their ability to hold the bones together properly. This can result in severe pain, swelling, and instability of the knee joint. In more severe cases, the ligament may completely rupture, leading to significant joint instability and loss of function. The severity of the sprain and type of sprain will vary depending on the type of injury and the underlying health of the knee ligaments. So now let's look at the signs and symptoms of a sprained knee. Signs and symptoms of a sprained knee can vary depending on the severity of the knee injury, but common indications include pain. Pain is a prevalent symptom of a sprained knee. It can range from mild discomfort to severe pain, especially when attempting to move or bear weight on the injured leg. The pain occurs due to the damage and inflammation of the ligaments and surrounding tissues. Swelling. Swelling around the knee joint is a typical response to a sprain. It happens because the body releases fluid and blood to the injured area as part of the inflammatory process. Swelling can cause stiffness and a feeling of tightness in the knee. Bruising. Bruising may develop due to small blood vessels being damaged during the injury. The bruised area can appear red, purple, or black, and typically takes a few days to appear after the initial injury. Instability. A sprained knee can result in a feeling of instability or weakness in the joint. This occurs when the ligaments are stretched or torn, affecting their ability to provide support and stability to the knee. Individuals may experience a sensation of the knee giving way or being unable to bear weight. Limited range of motion. A sprained knee can lead to decreased flexibility and restricted movement. Swelling, pain, and muscle guarding can contribute to the limitation of knee motion. These signs and symptoms occur as a result of the body's natural response to injury. When the ligaments are damaged, the body initiates an inflammatory process to promote healing. This process involves increased blood flow to the injured area, leading to swelling and pain. The swelling puts pressure on the surrounding structures, contributing to stiffness and limited range of motion. Additionally, nerve endings in the area may become sensitized, causing pain and discomfort. It is important to note that the severity of signs and symptoms can vary depending on the degree of ligament damage. Mild sprains may present with minimal swelling and discomfort, while a severe sprain can involve significant swelling, bruising, and difficulty moving the knee. Proper evaluation and diagnosis by a healthcare professional are essential to determine the extent of the injury and to develop an appropriate treatment plan. So now let's take a look at how a sprained knee is diagnosed. Diagnosing a knee sprain typically involves a comprehensive evaluation by a healthcare professional, such as a physician or orthopedic specialist. The diagnostic process may include the following: a thorough medical history. The healthcare provider will inquire about the circumstances surrounding the injury, including the mechanism of injury, symptoms experienced, and any previous knee issues or injuries. A physical examination. The affected knee will be thoroughly examined, assessing for swelling, bruising, tenderness, and range of motion. The healthcare provider may also perform specific tests to evaluate the stability and integrity of the ligaments, such as the anterior drawer test, posterior draw test, or valgus stress test. Imaging. X-rays are typically ordered to rule out any associated fractures or bone injuries. Although ligament injuries may not be visible on X-rays, they help ensure there are no other structural abnormalities, such as broken bones. In some cases, advanced imaging such as magnetic resonance imaging may be recommended to assess the extent of ligament damage. And finally, severity grading. Based on the findings from the physical examination and imaging, the healthcare provider may classify the sprain into different grades, such as mild grade 1, moderate grade 2, or severe grade 3, indicating the degree of ligament damage. Accurate diagnosis is crucial to determine the appropriate treatment plan. It helps guide decisions regarding conservative measures like rest, ice, compression, and elevation, RICE, as well as potential referrals for physical therapy, bracing, or surgical intervention in more severe cases. Now to wrap things up, let's look at the treatment for a sprained knee. The treatment options for a sprained knee depend on the severity of the injury and can vary from conservative measures to more intensive interventions. Some common treatment approaches include rest and protection. Initially, it is important to rest the injured knee and protect it from further injury or stress. This may involve avoiding physical activity, activities that exacerbate pain or instability, and using crutches or a knee brace to provide support and limit movement. Ice and compression. Applying an ice pack to the affected area can help reduce pain, swelling, and inflammation. Compression with an elastic bandage or knee sleeve can provide additional support and help control swelling. Elevating the injured knee above heart level can help reduce swelling by allowing fluid to drain away from the joint. Medications. Over-the-counter pain relievers like acetaminophen or nonsteroidal anti-inflammatory drugs can help manage pain and reduce inflammation. However, it's important to follow the recommended dosage and consult a healthcare professional if necessary. Physical therapy. In moderate to severe cases, a healthcare provider may recommend a physical therapist to restore strength, stability, and range of motion to the knee. A physical therapist can design individualized exercise programs to promote healing, improve flexibility, and enhance overall knee function. Immobilization and bracing. In certain cases, immobilizing the knee with a cast, splint, or brace may be necessary, especially for more severe sprains or to protect the knee during the healing process. Surgical intervention. Severe sprains involving complete ligament tears are cases where conservative treatment fails to alleviate symptoms, may require surgical repair or reconstruction. Surgery is generally reserved for specific cases and is determined by the severity of the injury and the individual's activity level. It is crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan tailored to the specific needs of the individual. They can guide the course of treatment based on the severity of the sprain, overall health, and lifestyle considerations to optimize recovery, minimize complications, and promote full recovery.